Welcome to my channel. Our today's topic is actinomycosis. Actinomycosis is a subacute disease which is chronic and granulomatous. It is suppurative and fibrosing disease which is caused by a bacteria known as actinomycosis. Actinomycosis is a commensal, okay, and it is the commensal of the oral flora. Coming to the morphology of the bacteria, it is an anaerobic bacteria which is microaerophilic, gram positive, non-acid fast bacteria which is branched and filamentous. It is actinomycosis israeli, actinomycosis viscus, actinomycosis odontolyticus, nellisundi and myri are the strands which are responsible for causing major cases and responsible for dissemination. Now, pathogenesis, how does this bacteria become pathogenic? It is a normal commensal of the oral cavity, but when trauma occurs, it leads to the disruption of this mucosal barrier, due to which there is an invasion of this bacteria. Initially, so first, after once the trauma occurs, there is a break in the mucosal barrier, and then from there invasion of this bacteria occurs. Now, initially there is an acute inflammation which leads to the chronic inflammation in an indolent phase. Form painless indurated swelling or abscess. It forms painless swelling. Then this swelling is separated, that is, it is accompanied with pus forming an abscess, and it drains by the formation of sinus tract. Okay, so the pus which is produced as an abscess contains sulfur granules. Okay, now coming to the clinical features. Age is peak incidence of this is seen in the middle age, and gender is usually male predilected, and male to female ratio is 3:1. Incidence increase in females due to use of intrauterine devices. Now, usually a lot of etiological factors could be there, but the exact cause is the trauma. Okay, and the age is the age is middle age, and slightly male predilection is seen, not slight, 3:1. Okay, now coming to the classification, it is cervicofacial, abdominal, urogenital, pulmonary. Okay, so if we remember the head, so if we come down, cervicofacial, okay, abdominal, urogenital and pulmonary. Okay, now cervicofacial actinomycosis is the most common form, that is, it is seen in 2/3 of all cases. So mostly seen in the facial region. Okay, and it is most common, that is 2/3 of all cases. Okay, now trauma is the main etiology. It produces a syndrome called lumpy jaw, which is, we will read what it is. Okay, now the soft tissue injury trauma which is occurring due to soft tissue injury in the periodontal pocket, non-vital tooth. Trauma can be occurring in your soft tissue, periodontal pocket, non-vital tooth, extraction socket, infected tonsil, plaque, calculus. Different factors of trauma can be there, like plaque, your periodontal pocket, your non-vital tooth, your extraction socket, infected tonsils, and spread. Now, spread is mostly from tongue. It spreads, and salivary glands. It spreads to the salivary glands from the tongue, then to the bone. It can spread to, okay, it's not like it's a pathway. It can spread to tongue, salivary glands, bone, skin, face. Gingiva is rare. Okay, now features. What is the features? So it produces swelling and induration of the tissue. Okay, first is it produces swelling. Secondly, this swelling develops into abscess. Okay, then discharge upon a skin surface is rarely a mucosal surface, liberating pus containing sulfur granules. So the feature of actinomycosis is it discharges pus upon the skin surface, and this pus contains something called as the sulfur granules. Okay, now moving forward, skin overlying the abscess is purplish red. It has your induration, and sometimes it can, if you touch, it can feel like wood. Okay, now sinus through which this abscess drains heals, but because of chronicity of the disease, new abscess can develop. Okay, scarring, then disfigurement of skin can also be seen. Pain is minimal, which is a very important criteria or characteristic of this bacteria. Infection can be extended to the mandible. It less commonly involves the maxilla. Actinomycotic osteomyelitis can also occur when it is occurring in the bone. Okay, and it may eventually involve cranium, meninges, and brain. This is the complication of this. Okay, complication. Now moving forward, such destructive lesion of bone may be localized at the apex. So the lesion can be localized at the apex, or it can stimulate the pulp related infections such as periapical granuloma or cyst. It may disseminate into distant organs such as brain, lungs, and GIT. Now that is about your cervicofacial actinomycosis. Right, now next is your abdominal actinomycosis, and yes, this is it, right? So this is about, this is about your actinomycosis. So if in cervicofacial actinomycosis, lumpy jaw has been asked for 5 marks, you have to first write what is the causative organism for lumpy jaw. Lumpy jaw is caused because of actinomycosis bacteria, which is, you have to give its morphology, which is gram positive, non-acid fast and branched. Then you have to give its different strands, that is Israeli viscous or Odontolyticus, Nelsundi, Myri, and then you have to describe its pathogenesis as to how it is affecting, that there is a trauma, and then there is a break in the mucosal membrane, then there is inflammation, then there is invasion of this bacteria, then there is formation of pus. Okay, the pus contains sulfur granules. You have to mention a little bit of clinical features, that is your peak evidence is seen in middle age, male predilected, 3:1 is the ratio, and in cervicofacial region the injuries could be soft tissue injury, periodontal pocket trauma, non-vital tooth, extraction socket, infected tonsils, plaque or calculus, and then it can usually spread to tongue, saliva, bone, skin, and if it spreads to tongue, it's called actinomycosis osteomyelitis. Right, now moving forward with your features, that it produces swelling, development into one or more abscess, and these pus contains sulfur granules. The overlying skin can have a wood-like appearance, or it can turn purplish red. Now since there is a sinus through abscess is draining, then if that abscess is healing, there is a formation of a new abscess. Then coming to the pain is minimal. Then we deal with actinomycosis osteomyelitis because it is affecting the maxillary bone. Okay, now if it is complicated, then it can involve cranium, meninges, and brain. Such destructive lesions can be localized at the apex of the teeth or stimulate pulp related infections. Now coming to the abdominal actinomycosis, which is extremely serious, and it is a form of disease which carries high mortality rate. So people with actinomycosis, abdominal actinomycosis, usually have a high mortality rate. Now this generalized symptoms of this abdominal actinomycosis is your fatigue, fever, chills, nausea, and vomiting. Coming to the and intestinal manifestations can also be seen, and there are symptoms involving other organs such as liver and spleen. See, as a dental student, we do not have much interest in the abdominal actinomycosis, but since we have to read about it, so I have written a few points which you can write in your exam. If actinomycosis has been asked as a 5 marker, you can write 3 points that The abdominal actinomycosis is severe and it has a high mortality rate. It has a generalized symptoms with clinical manifestations, and it can involve other organs. That's all you can write about abdominal. Then coming to the pulmonary also is same. It is also having generalized symptoms, and here something different, that is your cough is been produced. Coming to the sulfur granules, which are the, we talked about twice about this, that the sulfur granules are separative reaction of the infection, which are discharged in yellowish flakes that represent colonies of bacteria called sulfur granules. So basically, what are sulfur granules? They are your colonies of bacteria in yellow flocks or flecks. Okay, so this is nothing but your sulfur granules. So the other infections that produced by sulfur granules are botryomycosis, nocarditis, and chronic cervicofacial fungal infections. Okay, now coming to the histopath. Histopath is, this is a peripheral band of fibrous chelating zone of chronic inflamed granulation tissue. Basically, you don't have to write all this, just write that it has a peripheral band. I will show you a picture of actinomycosis. Okay, so the histopath diagram is something like this. It has a band of fibrosing tissue. This is the band of the fibrosing tissue, and then it has granulation zone. This is your granulation zone, and it contains centrally abscesses forming with colonies of bacteria. This is your colonies of bacteria. This is your sulfur granules, and your colonies are forming. Your individual colony appears round, lobulated meshwork of hematoxylin filaments. Now the one important characteristic feature is your ray fungus. If you clearly observe that these filaments which are produced looking like an filaments of ray fungus. So basically what I'm trying to say is the filaments which are staining with hematoxylin are giving a differential diagnosis of ray fungus. Okay, now methanamine silver stain is used to demonstrate this bacteria. Coming to the diagnosis, culture, we first diagnosis by collection of your swab, then that swab is cultured. After culture, you see sulfur granules in the microscope, which detects your actinomycosis. Okay, now treatment is your long-standing fibrosis are treated by, firstly there is a pus forming or separative infection. So first we drain out the pus, then we excise the sinus tract, and then we give high doses of antibiotics such as penicillin is your basic antibiotic, tetracycline, which is more stronger, and erythromycin. So basic antibiotics we are prescribing penicillin, tetracycline, and erythromycin. And then yeah, that's it. HIV, transplantation, and chemotherapy can also occur, can also cause this actinomycosis infection, because it is also at the end of the day a type of opportunistic infection, right? So it can also be seen in immunosuppressed patients. Okay, thank you so much for watching. That's all for actinomycosis. Next we will be dealing with syphilis. Syphilis is also quite a long topic, but we will finish syphilis in the next video. Then after that we will be dealing with scarlet fever, noma. There are a few more things, and we will wrap this chapter. Thank you for watching. Please subscribe to my channel and follow for more.